All right. Good morning, everyone. Thank you for joining us for the North Central Region Aging Network's March webinar. We will be talking about the social determinants of health today and applying the concept to aging. And I appreciate you hanging through and working with us on our technical difficulties this morning. So we've got a couple people still admitting people from the waiting room, and hopefully we can have some good conversation and the technology continues to work. So I am Erin Yellen from Kansas State University, and we'll be talking about the social determinants of health. This is an area that I have been particularly interested in the past few years, and I am currently a fellow for e-extension in the area of social determinants of health. And so this is an area I've been really pleased to be able to continue working in. So let's see. Okay, so what we're going to be doing today, we're first going to start by gauging our understanding, just seeing where we're at with our understanding of the social determinants of health. We'll go over what the determinants are. Then we'll talk about how they relate to aging. And at the end, we'll do a little bit on what we can do about it. So we are going to utilize Poll Everywhere today, and you can go to the link on the screen. I'm also going to type it into the chat box here. And hopefully that will work just fine. So I'll give you just a minute to go ahead and get logged into that. Of course, I had it all pulled up and ready to go. And then when Zoom stopped working, I have it all buried on my screen. Okay. Okay, so we're going to start off with a temperature check here. And oh, looks like you guys are already getting into it. Is that correct? Darn it. Okay, so is it letting you give responses? Goodness gracious, this is not my day.
It's not, Erin, no.
Okay.
Erin, you probably have to activate the poll.
I did, but I used this previously on another presentation, and I guess it didn't clear. Okay.
I just put one in, Erin.
Oh, okay. Well, it looks like it's coming through on the poll everywhere, but it's not coming in on our screen. So I will just surprise you with the results. I see them on my screen on the other side. So I really like to gain some sort of understanding of where people are at with the social determinants of health. So currently, 67% of you say that you have a good deal of understanding, and the rest of you say that you have some understanding. And I will tell you that this is very similar to the responses that I have seen when I've done this presentation otherwise. We seem to have some understanding across the board. And as this really becomes more of a focus across extension, we're hoping that we see these numbers start to increase and have people get more to the top of that chart. And I will tell you that even though this is a big focus of the work that I've been doing recently, I am by no means an expert, and I'm always learning about the social determinants and how important they are and how they affect people's health. So good to know that you guys have a good amount of understanding already. Okay, so this is our next poll that's likely not going to work. And with this one, I wanted to ask you what words come to mind when you think of the social determinants of health. So instead of doing it in Poll Everywhere, let's go ahead and just use the chat box. What words come to mind when you think of the social determinants of health? And my screen stopped sharing. Okay. Thank you. I appreciate you bearing with me. All right, so I see public health and equity, that it's not deterministic from Jim, that it is holistic, family, friends, church, and equity, emotional supports, where you live, work, and play. Yes, Debbie, that's a phrase that we hear often with this. Access, yeah, access is huge when you're talking about the social determinants of health. So thank you for responding there. And hopefully you can see the responses that I've got the last time we did this poll. A lot of the responses that came up were largely based on environment, equity, income. We also saw things like inequity, neighborhood, inequality, let's see, access, genetics, context, living, security, poverty, community resources, Eleanor just put in. So there's a lot of things that come to mind when you think of the social determinants, and all of them are correct. There's so many things that feed into the determinants, which is one of the reasons why it is such a big, complicated, monstrous issue. So I wanted to go through a few models that cover the social determinants of health. You're going to see, if you look up the social determinants, there are just dozens of models, but all of them in the end mean the same exact thing. They're just really breaking out the concepts into different buckets. But at the end of the day, they all come together to create the social determinants of health. So this is a model that is actually inspiring the next version of the Cooperative Extension's framework for health and wellness. That originally came out in 2014, and we are currently working on the updated version. And I'm serving on that task force under the direction of Dr. Roger Rennenkamp, who is the E-Extension Health Director. And he is leading this excellent task force to reinvigorate that model of health and wellness for extension. And some of the social determinants of health that will be included in our model are inspired from this model that you see here. Though we have added a few more, so you'll be seeing that when that's finally released. But you see that they have physical environment, public safety, social environment, transportation, education, employment, health systems and services, housing, and then finally income and wealth. And this is from the National Academy of Sciences. You will see that around the outside that structural inequities and biases, socioeconomic and political drivers, those really encompass everything that occurs within our social determinants and what influences our health. And so when we talk about the social determinants, we always need to use the lens of those inequities and biases and other drivers of health, because none of those things exist on their own. So you can see then on the inside here that the goal identified by the National Academy of Sciences is having healthier, more equitable communities in which individuals and families live, learn, work, and play. And that is generally the center concept or the goal that you will see in a lot of these models, is having the opportunity for everyone to be as healthy as possible. Oop. Okay, the next model also has very similar categories of social determinants, but you can see that they all vary. So when I say that we have different buckets, but they all come together to make the same concept, here's another example of that. So this model identifies economic stability, neighborhood and physical environment, education, food, community and social context, and the healthcare system, all of which feed into health outcomes, which can be measured by a variety of constructs. You will see within the grayish, bluish to white section of this model that there are examples of what each construct can include. And this always isn't limited to these sorts of things, and lots of different sort of influences can come into these categories. These are just a few examples. So with economic stability, do you have a stable income? Do you have access to gainful employment? With neighborhood and physical environment, what does your air quality look like? What does your water quality look like? Do you live in Manhattan, Kansas that has really great water quality like me? Or do you live in Flint, Michigan, who is still struggling with access to clean and healthy water? Do you have access to early childhood education for your children? Did you have access to higher education? Are you able to be successful in these arenas? Did your parents read to you when you were a kid? These are all social determinants. With food, a big part of Extension's work recently has been access to healthy and affordable foods. Do kids have access to that at school? Do older adults have access to that? And by access, we're not just talking about being able to go to the store and pick it up. We're also talking about, do you have the transportation to be able to get to the store? Do you have the funds to be able to afford to buy healthy produce versus more processed foods that may be less expensive? Community and social context. When we apply the social determinants to aging, you will see loneliness and social isolation really come out as big predictors of older adult health. And that relates back to this community and social context. Do you have community support? Do you have family and friends around to help and support you and get you from A to B? Do you have people who are helping you manage your medications, take you to the doctor, interpret what the doctor is saying, those sorts of things? Then you go into the healthcare system, which is obviously incredibly complicated. And that comes down to, do you have insurance? Do you have a provider that speaks your language? Do you have someone that is willing to sit down and really understand you and your health goals? Or is it a 30-second in and out, you look great, good to go sort of visit? Do you understand? Again, do you even have providers available? Here in Kansas, we still have counties where there is no licensed medical professional available, being either a doctor or a nurse practitioner. That exists, and is something that we need to be aware of. But the same thing can also happen in urban communities where you may not have access to a provider within your neighborhood. Moving on, the next model, this comes from the Centers for Disease Control and Prevention, and they have 5 buckets. And again, you can see that all of these are coming together. So the CDC recognizes education access and quality, healthcare and quality, neighborhood and built environment, and then social and community context, followed by economic stability. So I'm sure by now you're seeing the trends of what exactly the social determinants of health are. So why does this matter, and how big of an influence do the social determinants have on an individual's health outcomes? If you've seen this before, you know that it comes from the county health rankings model. And this is a model that they put out in 2014, the same time that the Cooperative Extension Framework for Health and Wellness came out. And the The county health rankings folks do recognize that this needs to be updated, and I have heard that they are working on an update for this, but this is the best sort of model that they currently have that can help guide the work that we're doing in extension. So you can see here at the bottom, around the red square there, these are the things that encompass the social determinants of health. So your clinical care, your social and economic factors, and your physical environment. On the right, then you can see some of the constructs that make that up. And in all, that contributes 70% to your overall health outcomes, which the county health rankings divides into length of life and quality of life. This is an area in which historically extension has not always focused or put a lot of focus into these types of things. Instead, historically, extension has been deeply rooted in community education, and there's nothing wrong with that. But it has been proposed that extension needs to take a twin approach, which means that we need to continue to do quality research and evidence-based community education, which encompasses a lot of those health behaviors, but that we also need to address the social determinants of health through policy systems and environmental changes. And when we do both of those things, we are addressing more than the 30% or 50% if we've done something else. We are really getting at more of that holistic collective view and helping to put that 100% of the health factors into the work that we're doing in extension. So why do the social determinants matter? What does it actually look like? So we've seen the words in black and white. We know about air quality and water quality or having access to a doctor and things like that. But when you actually get the boots on the ground, what does it look like? We know, and it has been said before, that your zip code has more to do with your health than almost anything. And one of the strongest examples that I see used over and over is the difference in health outcomes and life expectancy in Baltimore County, Maryland. This has a particularly egregious difference in very close proximity to each other. So on this map, while it might look like these two areas are far away, they're really not. It's like 10 minutes away going by car through traffic in Baltimore County. So it's really not that different. But there are huge differences. So you can see on this chart or on this map here, the dark green areas are areas in which life expectancy is higher. Then the lighter color you go, the lower the life expectancy is. So you can see in the top left, we have higher life expectancies. In that one area in particular, the life expectancy is 86. Then we go 10 minutes down the road and the life expectancy is 63. Obviously, major, huge difference. So what does that actually look like? What do those neighborhoods look like? I went into Google Street View and found the main intersection within each of these areas. And next we're gonna look at what that's like. This is the middle of the 63 life expectancy area. And I just want to give you a few seconds to look, examine, notice, take things in. The intersection here is right around this area of Madison and North Bradford Street up in there. So I want you to go ahead and use the chat box to tell me what are your reactions, but also What do you think the social determinants of health are in this area? So what are your reactions? How does it make you feel? And what do you think the social determinants of health are? Okay, so Debbie says that her reaction is depression. It is super depressing. I mean, it's really a punch to the gut. And for me, when you see the next location, it stings. So there's lots of shuttered windows, which indicates a limited access to resources. Pat says her reaction is that she's sad. Christy says the social determinants are housing, education, employment. Debbie shared lack of access to healthcare and healthy food, a bit rundown and old, low SES, socioeconomic status, lack of businesses, lack of transportation, low socioeconomic level. Yes, all of those things are correct. So when I was on Google Street View here, I went and clicked on the arrows so you can actually like travel down the road in real time. And I went up and down the road in both directions, this being a major street, and there were no businesses. There were no grocery stores. I didn't see a doctor's office. I didn't see much of anything except like what you're seeing here. But people obviously live here. I mean, you can see people in the photo here. You can see people when you walk down the street in this area through the Google Street View. People live here, but do they live in a healthy way? Do they have access to much of anything? What is it like for them? And do they have the ability to be healthy and live, you know, the life that perhaps they might want to live in this area? There's just so much to think about when you see this picture. And there's my dog. So abandoned buildings, it's unkempt, weedy sidewalks, great place for drug deals. Yes, absolutely. So you don't need to respond in the chat box. You can if you want, but I just want you to imagine being an older adult in this environment and trying to get to the doctor, trying to get to a pharmacy to get your diabetes medication. Debbie shared that she would feel overwhelmed living there and hopeless. So now we're going to skip over the poll everywhere that's not working, and we're going to go to the area where the life expectancy is 86. So this is the intersection around here, sort of in the middle of that green or dark green area around 39th Street, and I forget what that street was called, but here it is. And I'm not talking because still when I look at it and I compare the last picture to this picture, it really takes my breath away. So what do you see that's different in this area compared to the area that we just saw? So what's different? Go ahead and put it in the chat box. Okay, so I see vibrancy, choices, sidewalks and safety, safe walkability, public transportation access, commerce, jobs, clean, neat, inviting, highly commuted area, well-kept sidewalks and landscaping. Lots of transportation options, bus stop, cars, bikes. Yes, all of these things. On the left-hand side, it was a little difficult to see, but there is a bus stop there that's well marked and looks like it has, little boxes identifying the different routes or buses that might be coming by. You can't see or read the businesses that are on the sign there, but I looked them up, and there's a doctor's office in there. There's like an insurance agency, but there's also an organic food store. There's coffee shops and restaurants and, businesses that contribute to the well-being of individuals. You can also see the guy walking with his bike, looking at the BMW that was pulling out of the parking lot. We obviously see very clear differences. The sidewalks are night and day compared to the last picture. We see a beautiful brick crosswalk there. There's so many things that are different within a 10-minute drive. It's really amazing. And these two pictures really encapsulate the social determinants of health. Okay, let's skip the next one. Okay, so I want you to just take one last second to compare the two areas. When you put these two pictures side by side, it really speaks to me, and I know it can speak to others as well. But again, this is a 10-minute distance from each other. Look at the quality of life that individuals have the opportunity to live in and to have between these two areas. And applying the concept to aging, what would it be like to live in either of these areas as an older adult? And Amy just shared that it makes me sick to my stomach. And I completely agree with that. I am admittedly a privileged white woman that is well educated, came from a community that looks like the one on the right. And I admit that those are my biases, and that's the way or the place where I come from. And when I think about an individual who was born the same day as I was, but in that picture on the left-hand side, I can't imagine the difference between that person and myself, and just how devastating that difference might be. And Debbie says, it's all around us. I can take you to countless areas close to me that show this contrast. Yes, I agree. Okay. So remember in that first model, how on the outside ring, it talked about social injustices and biases and all those sorts of things. At the end of the day, one of the biggest predictors of some of these social determinants of health, one of the biggest things that encapsulates all of it goes back to racism and injustice. And this can be an uncomfortable conversation for people. And I 100% admit that and recognize that. But it's a conversation that we need to have. And in the new updated framework for health and wellness within Extension, racism and injustice takes a major role. You will see an annex that is pretty strongly dedicated to racism and injustice and the role that Extension can play in that. Racism and injustice is highlighted within our model as a social determinant of health. And as such, our committee that ECOP has put together is really hoping that Extension can start to recognize racism and injustice, not saying that we haven't recognized it before, but become more comfortable with talking about it and addressing these issues. Because we know that they frame so many of the issues that we're trying to tackle in Extension. And racism is a public health crisis. So, the American Public Health Association, which is the major sort of governing body of public health in the US, has come out and identified racism as a public health crisis. You will also see things from the World Health Organization, from the CDC, from numerous organizations and agencies that identify racism as a public health crisis. And again, this is a major social determinant of health. If you go back to those pictures of the 63 versus the 86, who did you see in the 63? It was Black people in that area. Who did we see on the right? White people, right? And that is a really meaningful difference, because right there you can see the difference between, or the difference that's created because of racism and injustices. So you can see on the top left here a sign that says racism is a public health crisis. I love the one on the bottom that says 2 deadly viruses are killing Black Americans, COVID-19 and racism. If you've seen the data on the disproportionate amount of Black people who have died as a result of COVID compared to white people, it's really shocking. You can see also that patients over profits, healthcare justice, that Black Lives Matter in the healthcare system. You see racism as a pandemic. There was a day where health professionals had a lot of different marches and trying to bring light to the fact of racism and how it feeds into the healthcare system. You see that racism makes our patients sick. Racism is a public health crisis, that racism is a pandemic. So this is largely recognized as an issue. However, when it comes to talking about it, sometimes we can shy away from it. Or we're just not sure what to do about it. And that's an area where we need to start having those uncomfortable conversations, because again, the social determinants are very deeply rooted in racism and injustice. So Debbie shared in the chat that in Alabama, they have the Civil Rights Institute in Birmingham and the Legacy Museum in Montgomery that addresses racism. Jennifer says, I'm proud to say that my county commissioners and city council members declared racism as a public health crisis in Franklin County, Ohio, and the city of Columbus. That's huge. I've not heard that. Their declaration gives credibility to your work addressing the social determinants of health as an extension educator. That's amazing, Jennifer. I'm so excited that you shared that. Okay. So moving on, this poll might work. If it doesn't, let's just use the chat box. But I want you to answer the question of, how have you seen racism and injustice affect one's ability to age healthfully? What's an example that you know of, or that you've seen, or you just read about, where racism was a determining factor of someone's ability to age well, in whatever context you want to put that in? So both racism and injustice, that could also include ageism. How can these things affect your ability to age well? So lack of public transportation and a lack of broadband, yes. So there are a major area of injustice as well, particularly in Kansas, just because that's what I know right now, is the major issues and disparities between rural and urban with access to internet. There's a lot of really great stuff going on with telehealth access because of the pandemic. Access to telehealth was like such a major issue. And then as soon as a pandemic hit, we all of a sudden figured it out. But in rural Kansas, we still have people who have dial-up internet and unstable connections. And the rurality of that is an injustice. But you can also see the same thing in urban areas as well. Yeah, telemedicine is wonderful, but only if you have access. Exactly. Geographically, difficulty reaching healthcare facilities, homelessness. Risk for heart disease and other chronic conditions is higher among African Americans, largely due to chronic stress associated with racism, with experiencing and anticipating microaggressions on a daily basis. That is awesome. Awesome sharing. I mean, it's not an awesome concept, but jobs that do not provide health insurance. Okay. One thing in Kansas, Cooperative Extension has been involved a bit in helping to train community health workers. And I have learned so much from community health workers, way more than they'll ever learn from me. And one of the concepts that I learned recently was about redlining. And I admit that I probably live under a rock with a lot of things because this was a brand new concept to me. But like I said before, I'm a white, middle-class, well-educated woman, and I've never experienced redlining. But that's something that I recently learned about and have become really aware of. And it's a concept that we know. I just really didn't know there was a word for it. But it's the redlining is the systemic denial of various services or goods. Basically, because of who you are or where you live, there's this red line that just metaphorically exists when it comes to a person's access. It's a really interesting concept. I encourage you to Google it, but there's just so many things that get cut off because of racism and injustice or ageism or any of the other isms that we can experience. Debbie then shares, I see it with injustice in terms of the judicial system and sentences imposed. It impacts entire families. I also see it with lack of family structure that is very related to education and community support. Yes, thank you. Okay, so next I want to apply the concept of social determinants of health to aging a bit more specifically. So in this example, I'm going to walk us through it, and then in the next one, hopefully we can talk about more of it together. So oral health is an outcome that I would like to explore first, and using the CDC's model. So I'm going to go through and give some examples. Now, these examples are data driven. So when we go on to the next slide, we don't need to have data. We can just make assumptions. But here are some data driven sort of connections between the social determinants and oral health. So how does education, access, and quality affect oral health? There is data that shows that low literacy is directly linked to poor oral health and periodontal disease. Healthcare access and quality. My toolbar is in my way. There it goes. Maine has fewer dentists per capita than in the United States overall. They have one of the lowest rates of that. So they have half a dentist for every 10,000 people. Also in Maine, I was able to find a study on this. Their dental workforce is aging and a lot of retirements. And a lot of people don't have dental insurance. I know many of us, dental is not covered in our insurance plans and you have to pay extra. With neighborhood and built environment, how does that affect oral health? People can have low access to healthy foods. So less healthy foods can contribute to periodontal disease and gum health and oral health and all of that together. Maybe you don't have transportation access to get to the dentist. With social and community context, loneliness and social isolation are directly linked to oral health, and it goes both ways. So the more lonely and socially isolated you are, the more likely you are to have poorer oral health, and it goes vice versa as well. With economic stability, the number one reason older adults don't go to the dentist is because of cost. And about 50% of older adults with an annual income of $15,000 or less have zero permanent teeth, compared to 4% of people who have zero permanent teeth who earn $50,000 or more. So next, I want to go and have us explore the social determinants of health as they relate to aging with the health outcome of diabetes. So what are some examples of each of these areas and how do they contribute to diabetes? Oh, and thank you, Amy, that Medicare does not cover dental. So I want you to go ahead and type in the chat box how some of these areas can affect either a risk of diabetes or ability to maintain your diabetic treatments and those sorts of things. So Jennifer says insurance may not cover diabetes education. There may not be an endocrinologist nearby. Maggie says lack of nutrition education, food desert, lack of access to food, period, lack of access to healthy food, living in a food swamp, less preventative measures are taken and less access to healthcare and doctor visits. All of these are correct. You guys are getting the concept really well. Less opportunities for safe physical activity. Really good one, Christy. There's so many things that feed into our social determinants in each of these categories. So thinking about food alone and having access to healthy, affordable food, you can see that happen in your neighborhood and built environment, your social and community context, your economic stability. So when we think about this area on the left-hand side where the life expectancy is 63, we can imagine that the resources that you have and the social determinants that you experience are far different than if you were to live in this area. So I want to go ahead and summarize some of what we've been talking about. So TLDR, for those of you who don't have children that teach you cool things, means too long, didn't read. So another way to say summary. So the entire world around you, near and far, big and small, affects your ability to be healthy. And the more positive things in your life and environment, the healthier you are, but you can't necessarily control it yourself, and it takes all of us. We can no longer ignore racism, poverty, social injustices, climate change, and accessibility. And these are the major issues influencing our ability to be healthy and well, and nothing will change unless we do. So, one of the things that we have put out in Extension recently, and we're starting to initiate this conversation, is that it's high time that Extension and that we all embrace the uncomfortable, complex, and wicked issues that the social determinants of health can bring. So, what can we do about it? One of the things that I have seen is that folks are not necessarily understanding the social determinants of health and within policy systems and environmental change. And the way to look at it and remember it is that the social determinants of health are sort of what we're working toward, and policy systems and environmental changes are the ways that we address those social determinants of health. So policy systems and environmental change is a process that's working towards the outcome of improved social determinants of health. And in order to do that, we must work with others, which of course we're really good at in Extension, lots of good partnerships and collective work that's going on. But within Extension, a major conversation also is that we need to be rewarded for working in policy systems and environmental change. I know that in many states, how you're rewarded is on the number of educational programs that you provide per month. And that's how your county boards or commissioners or whomever is evaluating you. And so we need to have a cultural shift within Extension to begin to address these broader issues. So addressing the social determinants doesn't always have to be a huge thing. And so here I want to provide a couple of examples of a huge idea, but then also a huge idea that isn't so huge, if that makes sense. So a big idea of a social determinant of health is climate change. This came out before the pandemic hit, this quote, so keep that in mind. But it says that the greatest global health threat to the 21st century is climate change. And maybe the biggest global health threat in the past couple of years was COVID, but climate change is still a big issue. And you can see some of the key facts here on climate change that come from the World Health Organization, that it affects all of our determinants of health. It's expected to cause 250,000 additional deaths per year because of malnutrition, malaria, diarrhea, and heat stress. The direct damages of costs to our health are huge. We have areas with a weak health infrastructure will be the least able to cope, and that reducing emissions and greenhouse gases will result in improved health, particularly through reduced air pollution. So this is a big idea that requires big changes, but we can also have big ideas and create big changes in ways that Extension is in what we're already doing and what we're able to accomplish. So in Kansas, we recently did a Culture of Health grant initiative. And with that, we gave counties $5,000 to implement some sort of policy systems and environmental change in their community. And with that, we gave out, I believe, 30 grants to 30 different counties. And with that, we served more than 24,000 Kansans through those initiatives. So we have this big comparison of doing huge work to address climate change, but then within the work that Extension is capable of doing and the reach that we're able to have, those $5,000 for those 30 communities reached 24,000 Kansans directly. And the ways in which we were able to use those funds and the changes that we were able to make were through the development of community gardens, micro food pantries, or also called blessing boxes, There was a school in rural Kansas that had deplorable access to water in their school. They didn't have functioning water fountains and these sorts of things. And we were able to purchase water bottle filling stations for those students and staff. We were able to partner with Parks and Rec in cities and counties to build walking trails and sidewalks. There was a particular area where kids did not have a sidewalk to get to the school safely, and we were able to contribute to providing funds to build that sidewalk. Also providing summer meal programs in rural communities, installing exercise equipment in a low-income housing area. That one was really cool, and a lot of older adults lived in that area. Then providing behavioral health support to Kansas youth and adults, and so many more things. So even though we have big ideas of climate change at the global level, in Kansas and in your state, in your community, in your county, you can also have big ideas that are easily, or maybe not so easily, but they are achievable. We don't have to always be, tackling the biggest horse we can find. We can also identify those things that we can help to address and improve in our communities. And doing any sorts of those changes can make a big difference. So the last thing that I want to ask you, and again, skip the poll everywhere, just go into our chat box, but what is one action step you can take in your own work to help address a social determinant of health in your community? What's one thing you can do? So this doesn't have to be a big, huge idea. It could be simply learning more about the social determinants in your community, looking at data more closely to really see where the differences lie in your community, maybe identifying underserved and under-resourced populations in your community. So Christy shares, making sure materials are designed with literacy levels in mind and making sure examples are culturally appropriate. Yes. Make sure that those affected are at the table when solutions are discussed. That's huge. How many times are we talking about, helping to reach the indigenous populations? We have several tribes in Kansas, but we don't have any representatives from that indigenous population at the table. That's ridiculous, and obviously is not going to help our efforts. Making sure that they're there, support grant applications for sidewalks, attend public meetings about various issues, keep the conversation moving within county health coalitions and encouraging action. One of the things we are doing is making sure our images that you use in your materials are inclusive. That is wonderful. I will just quickly share about an image. I sent it to a couple of my colleagues that are on this call, but I was shopping at Target a few weeks ago, and I was passing through the pajama ladies section, and they had a wonderful picture of an older adult woman advertising particular products. And it was really amazing and completely took me aback that they are trying to be more inclusive. And I'm just bragging on Target. There's other companies that do it as well. Having kiddos who are in wheelchairs or kiddos that are differently abled and those sorts of things included. It just makes me feel more comfortable supporting companies that are more inclusive and are not always focusing on white, middle class, skinny people. So those images are huge. And in all of the things that we do in Extension, we really need to be focusing on being more inclusive. Okay. So one thing that I want to encourage you to do, where as we wrap up here, is to get on Connect Extension and join the health and well-being subgroup. So Connect Extension is a wonderful resource for extension professionals, and the health and well-being subgroup has a lot of cool blogs and resources and all sorts of things that can come out. It's a great way to connect professionals that are doing similar work so that we're not constantly reinventing the wheel. And you can do that through connect.extension.org. Connect Extension and E-Extension are the organizations through which I have my fellowship, and I have learned so much through the connections that I have made there. And yes, I say join, and like to share that. Imagine me saying that in my mom voice. So it's very serious. So as we wrap up, the North Central Region Aging Network, the North Central Region Aging Network is constantly trying to evaluate who are we reaching, how well are we doing, what do you guys think about the information that we're providing through our webinars. So we invite you to go take our survey at tinyurl.com/NCRAN survey. It's super quick and easy, and we would just really, really appreciate your feedback. And then lastly, for our next webinar, put it on your calendar. We'll be sending an email out about it soon. It's called Engaging Seniors in Research, a series of studies aiming to optimize over-the-counter medication labels. And I am super excited about that. And our colleague Christy will be providing that webinar from Michigan State on April 2nd. And the link is NCRAN. Oh, okay. So there is the link for tinyurl.com/NCRAN survey. Yep. And then the connect.extension.org. So if you go to connect.extension.org, you can create a profile and then go into the subgroups and join the health and well-being subgroup. And there's lots of good things on there that come out regularly. Okay, so with that, thank you for joining. Thank you for bearing with our technical difficulties. I promise we'll get it straightened out before our next webinar in April. But if you have any questions, feel free to throw them in the chat box now, or you can email me. I'll put my email in the chat box here. But I appreciate you guys joining us. Spread the word about our next webinar in April and about all of the resources that we can offer through ncran.org. You'll see lots of different programs and opportunities there. So thank you all for joining. If anyone has questions, I'll hang around for another couple of minutes. If not, I hope you have a great weekend.